Norethindrone is a medication used to prevent pregnancy, often known as the mini pill, because it does not contain estrogen. It is a form of progestin, which is a hormone that helps prevent pregnancy. It is more effective than certain other birth control methods like condoms, cervical cap, and diaphragm, but less effective than combination hormone birth control. Norethindrone is mainly used by women who cannot take estrogen. It is important to take this medication exactly as prescribed to reduce the risk of pregnancy. It's important to note that using this medication does not protect against sexually transmitted diseases. The daily dosage and optimal timing for taking this medication should be discussed with a healthcare provider. Before starting to take norethindrone, it's important to read the patient information leaflet provided by your pharmacist. This leaflet contains crucial information on when to take your pills and what to do if you miss a dose. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. Taking this medication after your evening meal or at bedtime may help if you have stomach upset or nausea with the medication. It's also important to begin taking this medication on the first day of your menstrual period. If you begin taking it on any other day, use an additional form of non-hormonal birth control for the first 48 hours to prevent pregnancy until the medication has enough time to work. Continue taking one tablet every day, and after taking the last tablet in a pack, start a new pack the next day. There is no break between packs, and you do not take any reminder tablets without medication. Your periods may be irregular, or heavier/lighter than usual, and you may also have vaginal bleeding between periods. Do not stop taking your pills if this happens. If you miss a pill, start a new pack late, or take your pill at a different time of the day than usual. Use a backup method of birth control every time you have sex for the next 48 hours. It's important to ask your doctor or pharmacist about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor. Some common side effects of norethindrone may include nausea, vomiting, headache, bloating, breast tenderness, or weight gain. You may also experience vaginal bleeding between periods or have missed/irregular periods. If you experience any of these side effects and they persist or worsen, it's important to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefits to you outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as lumps in the breast, changes in mood or mental health, severe stomach or abdominal pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes or skin. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, and you can also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects and report side effects to Health Canada at 1-866-234-2345. Before taking norethindrone, it's important to let your doctor or pharmacist know if you have any allergies to norethindrone or other progestins, as well as any other allergies you may have. This medication may also contain inactive ingredients that could cause allergic reactions, so it's best to discuss this with your pharmacist for more information. It's also important to discuss your medical history with your doctor, especially if you have a history of abnormal breast exams, certain types of cancer, low levels of good cholesterol, depression, diabetes, severe headaches or migraines, liver disease, or unexplained vaginal bleeding. It's crucial to inform your doctor about all the products you use, including prescription drugs, non-prescription drugs, and herbal products, before undergoing any surgery. Norethindrone may cause blotchy, dark areas on your face and skin, known as melasma, and sunlight can worsen this effect. It's recommended to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. It's important to note that norethindrone should not be used during pregnancy, and if you become pregnant or think you may be pregnant, it's crucial to inform your doctor right away. Additionally, this medication can pass into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that may affect how norethindrone works. Some medications, such as griseofulvin, modafinil, and HIV drugs, can decrease the effectiveness of hormonal birth control, increasing the risk of pregnancy. It's crucial to inform your doctor of all the medications and herbal products you are using, and to consult with them before starting, stopping, or changing any medications. Additionally, norethindrone may interfere with certain lab tests, potentially causing false results. It's important to make sure that all lab personnel and doctors are aware that you are taking this medication. If you experience any new spotting or breakthrough bleeding, it's important to inform your doctor, as these may be signs that your birth control is not working effectively. When starting a new medication, it's important to consult with your doctor to determine if additional reliable birth control is necessary. And finally, it's important to discuss the best time and dosage for taking norethindrone to maximize its benefits. If you or someone has taken too much norethindrone and is experiencing severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe nausea, vomiting, and sudden or unusual vaginal bleeding. If any of these symptoms occur, seek medical help immediately. It's important not to share norethindrone with others. You should also make sure to have regular physical exams, including lab and/or medical tests like blood pressure, breast exams, pelvic exams, and pap smears, while you're taking this medication. Follow your doctor's instructions for examining your breasts, and report any lumps right away. Be sure to keep all your medical and lab appointments and consult your doctor for more details. If you miss a dose, refer to the product package information for advice on what to do. You may also need to use backup birth control, like condoms or spermicide, to prevent pregnancy. If you have any questions, it's best to ask your doctor or pharmacist. If you often forget to take your pills as directed, it's important to talk to your doctor about possibly switching to another form of birth control that may be easier for you to remember. Make sure to store your norethindrone at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When you no longer need it or it's expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.